Hi there. This is Dr. Bruce Kanehl from Jacksonville, Florida, and I have a topic that I'm going to speak to you about today that is very dear to my heart, and I love treating my patients for snoring and obstructive sleep apnea. Very dear to my heart is because I'm quite the snorer myself. Back in the 1980s, my wife and I were at the National Dental Convention, American Dental Association. There was a booth there about snoring. Guess who was my first patient? My wife said, "We are going to go check that out. You're driving me crazy with the snoring." We didn't know what obstructive sleep apnea was then, but over the years, things have progressed, and now we treat a lot of patients for obstructive sleep apnea and snoring. So, is snoring disrupting your night or your spouse's night? According to one study, 25% of Americans over the age of 40 sleep in different bedrooms because of snoring. Snoring is a major sign that you or your spouse may be suffering from obstructive sleep apnea. So what really is obstructive sleep apnea? On the picture to the right is the head of a patient lying down, and the blue arrows is where the air can enter to eventually go down into the trachea and into your lungs. So the blue arrow to the right obviously is in the mouth, and the one to the left is through the nose. Well, you'll see that there is a dead end at the bottom of the picture where there is an obstruction of the airway. Well, what causes this? Well, two major things. As we get older, sorry to say, we lose muscle tone. The tongue is a nice big muscle. When you lay down on your back at night, it falls right back into that airway and causes an obstruction. Also, sorry to say, as we get older, we usually gain weight. As we gain weight in our neck and in our jaws, that closes down your airway and you cannot breathe as well. So, what happens is we breathe at night, we're breathing for a little bit, then all of a sudden everything falls back and we're more or less choking to death. Apnea in Greek means no breathing. So, a true obstructive sleep apnea means that you're no breathing for a number of times while you sleep at night. If it's partially blocked and a little bit of air is going through, that uvula that hangs down in the back of your throat and the sides of your throat are moving at a rapid pace, kind of like a snare drum, guess what? You're snoring. So snoring is a sign of obstructive sleep apnea. What are the consequences of obstructive sleep apnea? High blood pressure is one. Because you're not getting oxygen to your lungs, oxygen is not being sent through your arteries and your veins and to your brain, and you get hardening of the arteries because the arteries want oxygen in the vessel walls, and blood pressure goes up. Difficulty staying awake during the day. Many people with obstructive sleep apnea want to take a nap in the afternoon, even while driving. If you have a tendency to fall asleep while driving, I had a lady this week said she fell asleep 8 times on her trip home, and she only lives 10 blocks from the office. People with obstructive sleep apnea, believe it or not, have a higher record of auto accidents than drunks on the road. Low energy, diabetes, acid reflux, all common consequences of obstructive sleep apnea. Tooth grinding, very common. You'll see people with their front teeth worn down from grinding their teeth at night, and the reason is they're trying to open up their airway. Death. There is a report that our Supreme Court judge, who just passed away in the last week, died from obstructive sleep apnea. Not confirmed, but if you look at him and you hear about his symptoms, it sounds like that's a possible cause. How I got started heavily in treating this is I knew of a dentist in Chicago who went to a dental meeting, forgot his CPAP, which is a type of treatment for obstructive sleep apnea, didn't wake up in the morning, died in his sleep. So, talking about a CPAP, the standard treatment, the golden treatment for obstructive sleep apnea, and this started in 1981, by the way, is a CPAP machine where air is blasted into your body through a machine. In 1981, actually, a vacuum cleaner was used by a physician in Australia, and that's how it all started. And that's how young this treatment is. Obstructive sleep apnea was started in 1981 for treatment, and it's just becoming really popular today. The problem with the CPAP machine is a percentage of people will not wear this. They need it, but they will not wear it. So that's how dentistry comes into play. Oral appliance therapy. Here is some pictures of different appliances. I've worn all of these. Since I do have obstructive sleep apnea, I like trying different appliances. They've all worked for me. These are all FDA approved. Most insurance companies will pay toward appliances. So some of our patients end up not having to pay anything because their insurance is so good. Even Medicare will pay a percentage of the fee for the therapy that we provide. There's no hoses, there are no masks. This fits comfortably in your mouth. If you want to travel, it's like the size of a little retainer that the kids wear for braces. You put it in a little case and you can travel with it. You don't have to take a suitcase with you, which is what you have to do with a CPAP. And it eliminates snoring and restores breathing. It can treat you just as well as a CPAP. Now, I have some examples here of what you see in the picture. This is that blue and red one that fits in the mouth. They call this a dorsal fin. It has two little fins. And what this appliance does is it brings your jaw in a forward or protrusive position, which opens up your airway. And so it makes your jaw kind of like you were when you're a child again. It physically opens up your airway by just bringing your jaw forward. Here's an Oasis appliance, one of my favorite appliances. It actually has some extra little gadgets. A lot of people with obstructive sleep apnea have breathing problems, so it actually helps you open up your breathing. So this is the upper part and the lower part, and how they fit together brings your jaw in a forward position. Here's a tap appliance, which is another very popular one. It's also one that's approved by Medicare, and it has the hinge in the front. And all of these are adjustable. There's a sweet spot where you get optimum performance. And so all of these have adjustments. This is the appliance that I'm wearing most recently. It's called a ResMed appliance. This one's nice and tiny. It's made by a computer, a 3D imaging machine. And the one that's different from all the rest, this is called a full breath appliance, developed by a friend of mine in California. It is only one. All the others you wear on the top and the bottom. This one fits on the bottom, has a little tail in the back that pulls your tongue down, and your tongue comes up through the little hole here, a little donut-like. So it forces your tongue. This is toward the front of your mouth. So this tail in the back brings your tongue forward. By bringing your tongue forward, opens up your airway, and you can breathe and have a good night's sleep, and so can your wife or your spouse. Here's an example of one of them in the mouth. It looks bulky here because she opened up her lips for us so we could see what it looks like. But they're actually fairly tiny, and she can put her lips on it and around it and breathe naturally. This one you can actually open wide, and if you want to drink a bottle of water at night, you can. So, if you're interested in treatment for snoring and or obstructive sleep apnea, you can go to our website at www.kanehldental.com, and there's an area there that will explain in a lot more detail than I have today about what obstructive sleep apnea and snoring is all about and what we do for it. Our phone number at our office in Jacksonville, Florida is area code 904-731-2162. Our consultation is free for the initial visit to just hear your story, see if you might be a candidate. We can even check on your insurance and see what kind of benefits you may have. And if you wish, then we can move forward from there and fabricate an appliance for you and work with you over a period of time in the future, really, to make sure things are working out great for you. So give us a call. We look forward to seeing you soon.